Welcome to NSG 227, Study Session 11. Changing an intravenous container, tubbing and dressing. Introduction. In the previous study session, we discussed administration of intravenous fluids. Maintaining asepsis during intravenous therapy is essential and decreases the risk of phlebitis and infection. In this study session, you will examine the purpose and technique of changing intravenous container, tubbing, and dressing. Learning outcomes. When you have studied this session, you should be able to 1. State the purpose for changing intravenous container, tubbing, and dressing. 2. List the articles needed for the procedure. 3. State the technique for the procedure. Reasons for changing intravenous tubbing. 1. To prevent infections. 2. To maintain patency of tubbing. Articles needed for changing intravenous tubbing. These are 1. IV fluid bottle or container. 2. IV drip set sterile. 3. Labels for applying to tubbing, container, and IV cannula. 4. Kidney tray or paper bag. 5. Sterile gaze piece. 6. A tray containing items for dressing. A. Sterile gloves. B. Sterile gaze piece. C. Antiseptic swab. D. Adhesive tape. E. Dressing gauze. F. Plastic sheet or underpad. Step-by-step technique. Nursing action. Rationale. 1. Obtain the correct solution. A. Verify with physician order. B. Read label of new container. C. Check name of solution, expiry date, constituent, and volume present. D. Check for any sediment, turbidity, and color change. Reduces risk of error. 2. Wash hands. Reduces risk of transmission of microorganisms. 3. Set up intravenous equipment by inserting insertion spike of tubbing into container, as in previous procedure, optional. Add medication to IV solution if required. A. Apply label to container, including medication added and timing. B. Prime the tubbing with solution. C. Label the tubbing with date and time of changing the tubbing. Communicate the details of medications added and change of tubbing. 4. Prepare dressing equipment. A. Prepare strips of tape as needed for the type of catheter or cannula used and hang them from the edges of tray or table. B. Open all equipment, swabs, dressing, ointment, etc. C. Place plastic sheet or underpad under extremity. Prevent air from entering into the vein. Study session summary. In this study session, you have learned the purpose for changing intravenous container, tubbing, and dressing, the articles needed for the procedure, and the state and the technique of the procedure. End of study session 11 and end of NSG 227. Thanks for listening.